Goni skill, wrist extension. Position the patient in sitting next to a supporting surface with the shoulder abducted to 90 degrees and the elbow in 90 degrees of flexion. Position the forearm midway between supination and pronation so that the palm of the hand faces the ground. Rest the arm on the supporting surface, but leave the hand free to move. Avoid radial and ulnar deviation of the wrist and extension of the fingers. Remember to test the unaffected limb first. In patient-appropriate language, ask the patient to extend the wrist. Assess the forearm for supination or pronation, the humerus for motion at the elbow, and the fingers for extension. Extend the wrist by applying a force evenly across the palmar surface of the metacarpals, moving the hand toward the ceiling. Maintain the wrist in 0 degrees of radial and ulnar deviation. Stabilize the radius and ulna to prevent supination and pronation of the forearm. The end of wrist extension range of motion occurs when the resistance is felt and additional motion causes the forearm to lift off the supporting surface. Assess the end feel of the joint. This is firm because of tension in the palmar radiocarpal ligament, ulnocarpal ligament, and palmar joint capsule. Tension in the palmaris longus, flexor carpi radialis, and flexor carpi ulnaris muscles may also contribute to the firm end feel. The end feel may sometimes be hard because of contact between the radius and the carpal bones. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. The size of the smaller plastic goniometer will make this measurement easier. Align the axis of the goniometer on the lateral aspect of the wrist over the triquetrum. Align the stationary arm with the lateral midline of the ulna using the olecranon and ulnar styloid processes for reference. Align the movable arm with the lateral midline of the fifth metacarpal. Do not use the soft tissue of the hypothenar eminence for reference. Ask the patient to perform extension of the wrist as done previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the forearm. Read the degrees of motion on the goniometer and then ask the patient to return the wrist to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. Average range of motion, according to the American Association of Orthopedic Surgeons, is 70 degrees.